need a knee replacement? Did you hear? It's bone on bone. Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Medical, and you're going to want to share this with your knee pain friends and family because you might save them from surgery. We have patients regularly telling us that their surgeons told them they need a knee replacement, that their MRI shows it's bone on bone. Well, that's pretty scary, right? And sometimes, without a doubt, let's be fair, that can be true. But is there anything else that can be done before resorting to such an extreme? Hey, let's face it, common or not, replacing entire joints in your body, it's quite a procedure, right? And the recovery can be extensive. Do yourself a favor, do not look up videos online showing the event, okay? So what can be done to try to avoid having to undergo this procedure? Well, there are several things that can be tried. Not only can be tried, but should be tried. So let's talk about it. When knee pain plagues us, we have a handful of first-line options when we're attempting to avoid knee replacement. Let's start with exercise, physical therapy type stuff. You can do targeted rehab, which we can do right here in the office, that lots of times can really make a difference. We also offer low-level laser here. A common treatment that we don't do here is cortisone injections. Also, another common one that we don't do here is hyaluronic acid injections. Then there are stem cell injections. And then a really good one we do here is called platelet-rich plasma. Also, it's known as PRP. And then finally, of course, there's surgery. So it is our position that a good number of these knee treatments should be tried and failed prior to agreeing to invasive knee replacement surgery, regardless of bone on bone and any of that stuff. You cannot determine absolutes based purely on imaging. You can't look at an image and go, it's bone on bone, you need surgery. You can't do that. Patients can have bone on bone x-rays and still have a good, solid quality of life. As far as the treatments, there are some pros and cons with each, and some treatments have more cons than pros, I would say. The most common treatment on this list that we covered is cortisone injections. Now, although cortisone joint injections are the most common treatments for knee pain, they do present issues. First, cortisone injections can be detrimental to the integrity of the structures in the joint, the cartilage and the bones. The cortisone can degrade the bone and cartilage, and while it's good for the inflammation, can cause more long-term issues. That's why they'll only perform about 3 injections of cortisone per joint. And secondly, cortisone isn't typically helpful from our experience, and if it is helpful, it's only short-term helpful, right? The effect doesn't last very long. It treats the inflammation, but it does not treat the cause of the inflammation, so the inflammation just returns eventually, and that requires more cortisone, which can further damage the joint, and that's not a cycle I want to be in, and so I don't recommend it for my patients either. So is there a better option for knee joint pain? And it turns out that yes, there is. It's called platelet-rich plasma, as we discussed, also again called PRP. According to the HSS education site, quote, platelet-rich plasma, PRP, uses injections of a concentration of a patient's own platelets to accelerate the healing of injured tendons, ligaments, muscles, and joints. In this way, PRP injections use each individual patient's own healing system to improve musculoskeletal problems. PRP injections are prepared by taking anywhere from 1 to a few tubes of your own blood and running it through a centrifuge to concentrate the platelets. These activated platelets are then injected directly into the injured or diseased body tissue, and this releases growth factors that stimulate and increase the number of reparative cells that your body produces. WebMD says, quote, a healthcare professional will collect a small amount of your blood. They'll place your blood into the centrifuge, spinning it at different speeds until it separates. One layer is the PRP, and this layer of plasma may have as much as 3 times more platelets than regular blood. The PRP will then be injected into the affected area. That's when the healing starts. Once the platelets are in the area that's being treated, they break down and release growth factors, which are compounds that help cells repair and renew. And this is thought to trigger your body's healing process. There are lots of good, solid research on this. We're going to put the links to some of the best papers into the comments, and on YouTube, we'll put it in the video description for you to be able to go and check out these links, okay? But these really solid research findings show that PRP is equal or superior to cortisone injections, and they're longer lasting than cortisone. At the end of the day, knee replacement surgery may be in the cards, may be completely unavoidable, which is 100% okay. But for my loved ones and my patients, I want to make sure they have done everything possible to avoid major surgery and a lengthy recovery process, especially when there's a chance that it could have been potentially avoided. We do the PRP right here at Creekstone Integrated Medical. If you're from the Texas Panhandle, or you're going to be passing through and you need our help, why don't you give us a call at 806-355-3000. Let's get you on our schedule. If you're watching on YouTube or Facebook, do us a favor, like, subscribe, comment, and share. It all helps us. Thank you for watching, and we'll see you again next week.